The rising popularity of weight loss drugs like tirzepatide and semaglutide reflects a growing demand for effective obesity treatments, but their exorbitant costs make them inaccessible to many Americans, placing an unfair financial burden on those who need them most. A new economic analysis, published in JAMA Health Forum, highlights the staggering reality. While these drugs offer substantial health benefits, they're simply not cost-effective at their current prices. The financial strain on patients, combined with insurance limitations and supply shortages, raises serious concerns about the sustainability and fairness of these treatments. Obesity affects over 2/5 of U.S. adults, making it a major public health crisis, yet the very medications that could help alleviate this burden remain out of reach for the average patient. Tirzepatide, sold as Zepbound, and semaglutide, marketed as Wegovy and Ozempic, have been shown to reduce obesity, diabetes, and cardiovascular disease, potentially saving lives. However, at an average cost of $1,000 per month, amounting to a staggering $12,000 per year, these drugs are a luxury rather than a realistic option for most patients. Even with Eli Lilly's so-called discounted alternative for tirzepatide, which brings the cost down to around $500 per month, many Americans still cannot afford the $5,000 annual expense. The promise of weight loss and improved health is reserved for those who can pay, leaving lower-income patients behind in a system that favors financial privilege over medical necessity. The analysis evaluated the cost-effectiveness of 4 weight loss medications: tirzepatide, semaglutide, phentermine and naltrexone bupropion, when combined with lifestyle modifications like diet and exercise. While all 4 medications showed positive health outcomes, tirzepatide and semaglutide had the most significant impact, reducing obesity cases, diabetes, and cardiovascular disease by the highest margins. But the financial implications cannot be ignored. The incremental cost-effectiveness ratio, ICR, which measures the cost per quality-adjusted life year, CALI, gained, revealed alarming figures. Tirzepatide had an ICR of $197,023 per CALI, while semaglutide reached a shocking $467,676 per CALI. These numbers far exceed what is considered cost-effective in the U.S. healthcare system, meaning that the benefits, while undeniable, come at an unreasonably high price. Beyond the raw cost, the study exposes an even more troubling reality: the potential for overestimated benefits and underestimated risks. Clinical trials often produce short-term results under controlled conditions, but real-world effectiveness can be far less impressive due to issues like patient adherence, side effects, and long-term metabolic changes. The researchers acknowledged several limitations in their analysis, including uncertainty about real-world adherence, long-term safety, and the exclusion of significant weight-related conditions like osteoarthritis and obstructive sleep apnea. The assumption that patients will maintain lifestyle modifications alongside medication use may also be overly optimistic, as adherence to such changes often declines over time. Meanwhile, less expensive alternatives like phentermine and naltrexone bupropion demonstrated better cost-effectiveness. Phentermine had a much lower ICR of $85,229 per CALI gained, while naltrexone bupropion actually saved costs. Yet these options receive far less attention than their high-price counterparts, largely due to aggressive marketing campaigns by pharmaceutical companies pushing the latest, most expensive treatments. This raises ethical concerns about whether drug companies are prioritizing profit over public health, charging inflated prices for medications that could be produced and sold at a fraction of the cost. The economic barriers surrounding these medications highlight the deep flaws in the U.S. healthcare system, where life-changing treatments remain out of reach for those who need them most. Instead of offering a realistic solution to the obesity epidemic, these drugs are creating a divide between those who can afford them and those who cannot, reinforcing disparities in health outcomes. While the study's authors urge efforts to reduce drug prices, the reality is that pharmaceutical companies have little incentive to do so. As long as demand remains high and insurance companies continue to restrict coverage, These medications will remain an expensive privilege rather than a widely accessible solution. The weight loss drug industry is at a crossroads. While tirzepatide and semaglutide offer real benefits, their astronomical costs make them an impractical and inequitable solution to the obesity crisis. Until pharmaceutical companies lower their prices or policymakers step in to regulate costs, these drugs will continue to be an unaffordable luxury for millions of Americans. Instead of placing the financial burden on patients, there must be a push for greater affordability and fair pricing. Otherwise, the promise of better health through weight loss medications will remain just that, a promise that only a select few can afford to fulfill.